Okay, we'll now start. Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. A reminder after the pep talk is to take the online learning com evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now and show your faces. Okay, ready? That's set. Ready? Get set. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk, the so-called core courses, then the health disorder courses, and health issue courses. I have delivered 240 pep talks from May 15, 2021 to May 9, 2026. That's 5 years, every Saturday from 2 to 3 p.m. And then May 16, 2026 marks the start of year number 6 of the ROJoson PEP Talk. How long the pep talk will last will depend on our enthusiasm, discipline, and perseverance. My pep talk today is entitled, How You Can Be and Stay Healthy at All Times. The empowerment objective is for the lay people to have an basic understanding of or on how to be and stay healthy at all times in their health management. In the last pep talk, I talked on why you need to be and stay healthy at all times. In this pep talk, I will talk on how you can be and stay healthy at all times. And in the next pep talk next week, I will be talking on how, as a physician, will help you, how I, as a physician, will help you be and stay healthy at all times. So the contents of this particular pep talk this afternoon consists of the following. What are the preventable diseases that can be aimed for in how to be and stay healthy at all times? As I said last time, we will be focusing on preventable diseases. Then the next topic will be, the main topic will be how you can be and stay healthy at all times after we identify the list of preventable diseases. So disclaimer, The ROJoson PEP Talk contains ROJoson's thoughts, perceptions, opinions, and recommendations, or TPORs, culled from experiences of ROJoson and those and the writings of other health professionals. So last time we talked about the operational definition to be to be and stay healthy at all times. This is from the last week. So we said that to be healthy and stay healthy at all times means we try to avoid a preventable disease. A preventable disease. So after that, the resultant effect will be the body, mind, and daily functioning are working well enough for the person to live effectively and adapt to life demands and struggles. And at all times means continuously, constantly, and without stopping, and always. So again, our operational definition of the phrase to be and stay healthy at all times means to be healthy and then to stay healthy thereafter, avoiding a preventable disease in which the body, mind, and daily functioning are working well enough for a person to live effectively and adapt to life demands, and to do it continuously, constantly, without stopping, and always. So we will not deal with non-preventable diseases. So, as I said, we will not deal with non-preventable diseases, which are the following. So the non-preventable diseases are the following: genetic and congenital diseases, meaning congenital means those present at birth, then genetic, those caused by genes. Okay. Then age-related degenerative diseases, yung mga tumatanda na, so we know that all of us will age eventually, we cannot stop it. So those are not preventable. Then autoimmune diseases, many cancers with strong genetic and spontaneous origins. We will not include that in our discussion also. Okay, but there are cancers which can be preventable. Okay. Then idiopathic diseases in which means the causes are not known. So there's no way in which we can prevent them if we don't know the cause. Then those caused by random and unavoidable conditions, like genetic mutation. Suddenly it just, there's a genetic mutations, now then a disease will occur. So we will not be discussing this one: genetic, congenital diseases, age-related degenerative diseases, autoimmune diseases, many cancers with strong and genetic origins, idiopathic diseases, and random and unavoidable conditions. But our focus here, based on our operational definition, is that we will deal with the following preventable diseases, which are categorized into 5: infectious communicable diseases, vaccine preventable diseases. Those can be diseases that can be prevented by vaccine. We will include them. Life-related diseases, diseases preventable by hygiene and sanitation, and then injury and environmental prevention. Okay. So these are the diseases that we will focus on because these are categorized as preventable diseases. So as I said, the focus will be on these 5 categories. Okay. So let me expound on the number 1, infectious communicable diseases. Examples will be a measles during probably in your childhood, but you can also have measles in your adulthood. Okay, polio, tuberculosis, pwede pang karoon, tuberculosis in adulthood, hepatitis A and B, influenza, very common, COVID-19 is still present, malaria, cholera, HIV, AIDS. Again, there's a rising incidence on HIV, AIDS nowadays. So this is preventable through safe practices and education. So this category, these diseases are caused by germs. Example will be bacteria, viruses, and parasites, and are often preventable with vaccines, sanitations, and hygiene. The other category of preventable diseases which we must prevent to be and stay healthy at all times will be the vaccine-related preventable diseases. So in the communicable diseases, there are some diseases which can be prevented by vaccine. But there are some diseases in which there are no vaccines available yet. Okay? So those with vaccine preventable diseases are the following: diphtheria. That's why during childhood, you have the DPT, kasama yung diphtheria doon. Tetanus, kasama din doon. Pertussis or whooping cough, kasama sa during childhood vaccination. Mumps, rubella. Okay. This is German measles. And then chickenpox, varicella, and the human papillomavirus, which is very common in adult women nowadays. Okay, so this can be prevented by vaccine. So there are vaccines for human papillomavirus. So this is a subset of infectious diseases that can be avoided through immunization. As I said, the infectious diseases can be categorized into two. Okay, one, wala pang vaccine that can prevent it. The other one, the other subset would be the vaccine. There are vaccines that can be used. Ito yung grupo ng merong vaccines na. Now, life-related diseases will be, all of you probably are familiar with this, okay? Heart disease, type 2 diabetes, obesity, certain cancers like lung cancer from smoking are usually preventable, hypertension or high blood pressure. So these are just 5 examples of lifestyle-related diseases which can be prevented. So the other category of preventable diseases to prevent, to be, and stay healthy at all times will be those which are preventable by hygiene, malinis, and sanitation. Diarrheal diseases, kung marumi ang kamay, marumi ang environment, you can have diarrhea. Ganun din sa typhoid fever, intestinal worms, mga parasites, and then some skin and eye infections. So these are largely preventable by healthy habits like hygiene and sanitation. The last category is those caused by injury and environmental factors and can be prevented. Okay? Example, road traffic injuries or accidents, and then occupational illnesses, and then poisoning. So in its traditional sense, these are not diseases, but still preventable health conditions. There is no way to guarantee being healthy at all times because illness, aging, genetics, accidents, and environmental exposures still occur. But many diseases and complications can be prevented and delayed, at least, by maintaining healthy habits and consistently. Importante yung the word consistently. Kaya sabi ko, at all times, dapat palagi, no stopping. Okay? So, before we go any further, we start with a self-assessment of our current health status and health. Then we formulate the health management plan. So if you categorize yourself as healthy without a disease whatsoever, then you continue your health management strategy, and if need be, to refine it on how you can be and stay healthy at all times. Now, if you categorize yourself as healthy with controlled disease, then you continue your healthy management regimen, and if need be, to refine it, and then make a special focus on how to manage your controlled diseases. So meron kayong sakit na nako-control, but you make a focus on that, but you cannot forget the usual general healthy lifestyle. Kasama pa rin yun. Now, the third classification of health assessment will be persons who are unhealthy with treatable diseases. Okay. So we try to strive to come out with a how to and stay healthy strategy with special focus on the treatable diseases. So kung unhealthy kayo, may sakit kayo na pwedeng gamutin. So aside from healthy lifestyle, then you still have to come out with a strategy that will try to treat the disease that you have. The key ways to prevent preventable diseases as well as to control or reverse current preventable or treatable diseases if present are the following. Number 1, vaccination. Number 2, hand washing and hygiene. Number 3, safe food and clean water. Number 4, regular exercise. Number 5, healthy diet. Then avoiding tobacco and excessive alcohol, safe sex practices, regular health checkups, healthy lifestyle, and being mindful and vigilant against preventable diseases. Now that you have a list of those preventable diseases already, and then we add some more. So being functional at all times, doing something, keep yourself productive, okay? And then adequate rest, then stress control and relationship management. This is in terms of managing your mental health. Okay? The main pillars on how you can be and stay healthy at all times are the following. There are 10 pillars that I would like to expound on. So number 1 pillar is eat a balanced, sustainable diet. So you focus on vegetables and fruits daily. So dapat may vegetables and fruits araw-araw. Then you adequate proteins in terms of fish, eggs, beans, and lean meat. And then whole grain and fiber, importante may fiber. And then adequate water intake, about 8, 10, 12 glasses a day. Then limit your ultra-processed foods, yung mga canned goods, no? Then sugary drinks, and also excessive salt. We have to add here excessive oil also. So a practical rule will be rely on plant-based foods, kung pwede. Then eat in moderation, moderate portions. Then avoid habitual overeating. So kung minsan, konti kakainin, kung minsan pwede dagdagan ng konti, no? Pero hindi man palaging marami at sobra. Okay. Number 2 pillar is exercise regularly. So aim for at least 150 minutes per week of moderate activity. Examples will be walking, cycling, and swimming. The most convenient here is still walking. No, walang gamit na you need to, let's say, you need a bicycle for cycling, you need a swimming pool or a beach for swimming. So walking, you can walk anywhere. Okay. So aside from the moderate activity of walking, you have to add especially those who are growing older, plus a muscle strengthening exercise 2 to 3 times a week. So even simple daily walking has major benefits. It lowers the cardiovascular risk, improves the blood sugar, and then reduces stress, and then preserves mobility with aging. Palaging nakakalakad pa, no? Habang tumatanda. The third pillar will be to sleep adequately. So in general, the adults need 7 to 9 hours of sleep, usually at night time. Okay? So poor sleep is associated with obesity, hypertension, diabetes, depression, and impaired immunity. And when you have good sleep hygiene, good sleep habit, if you have meaning this when you say good sleep hygiene, you have good consistent sleep schedule. Let's say here, daily, every day, meron kang continuous na 7 hours or 8 hours of sleep, maganda yun. Okay? And then, another practice of good sleep hygiene is to reduce the late night screening exposure, yung mga nasa cellphone, no? Okay. And then, limiting caffeine or coffee late in the day. So, kasi hindi kayo makakatulog kung inom kayo ng coffee. The fourth pillar will be to avoid harmful substances. So avoid entirely, if not minimize, smoking, vaping, excessive alcohol, recreational drugs. So smoking alone is one of the biggest preventable causes of cancer, stroke, heart disease, and COPD. So tanggalin na lang natin smoking, malaking chance na baka ma-avoid niyo itong mga cancer, stroke, heart disease, and COPD. Pag palagi tayo nag-smoke, you have higher risk for developing cancer, stroke, heart disease, and COPD, or lung disease. The fifth pillar will be to maintain a healthy body weight. So normal BMI dapat, so less than 25 sa BMI. So both obesity and being overweight can increase health risk. So the useful targets aside from the BMI will be healthy waist circumference, preserve muscle mass, and physical fitness, not just body weight alone. So don't just rely on the normal BMI, dapat fit na fit kayo, nag-exercise kayo, gumagalaw kayo. Number 6 pillar will be keep vaccinations updated. Usually, mga vaccines na kailangan natin nowadays. Vaccines prevent many serious diseases. Examples, influenza, COVID-19, tetanus, pneumococcal disease, hepatitis B, and HPV. Number 7 pillar will be to practice preventive health care. So do not wait until severe symptoms develop. Regular screening may include blood pressure, dapat alam niyo blood pressure niyo every now and then. Okay. Blood sugar, cholesterol, cancer screening, dental care, isama na ninyo. Then eye exam, especially those, baka magkaroon tayo ng glaucoma, especially those who are elderly. Okay. So early detection often leads to better outcomes. If you have this regular screening for all these possible risk for diseases. Number 8 pillars will be to manage stress and mental health. So chronic stress affects sleep, hindi kayo nakakatulog, it increase your high blood pressure, so it dampen your immunity, and then of course your eating behavior, kung minsan overeating na kayo because of the stress, then of course relationship with other people. So helpful exercise measures will be the following in stress and mental health will be exercise, have a good mga hobbies, social connection, mindfulness and prayer and meditations, and then counseling when needed. Then number 9 pillar will be to maintain social and intellectual activity. May socialization, may ginagawa rin, mental exercises. So people tend to stay healthier when they maintain friendship and family ties, then remain mentally active, then continuing learning, and then have a meaningful activities or purpose. The last pillar will be to practice safety and hygiene. So examples will be hand washing, safe food handling, seat belts and helmets, sun protection, avoiding risky behaviors. So important principle in how you can be and stay healthy at all times to remember, health is usually the result of many small good habits. Practice consistently over the years, and then, if not tuloy-tuloy forever, rather than occasional extreme efforts. Hindi pwedeng sabihin, may exercise regimen, magandang exercise ko, but this will last only for 1 week or 2 weeks. So it should be there forever. no, as much as possible. So the most effective long-term strategy is something that you do it on a moderate scale, then something sustainable, ginagawa nyo indefinitely, and then based on evidence-based, no, lifestyle habits. So magbabasa tayo, ano ba yung lifestyle habits na may researches that have been shown to have good results. No? So remember, the real goal is not perfect health forever. Alam natin yan, no? Because this is impossible, because all people will eventually get a disease and die. So the practical goals will be the following: maintain the best possible health as much as possible, best possible, prevent avoidable diseases, and then detect the illness early enough, and then preserve function and quality of life as long as possible. So galaw ng galaw, be active, be productive. Okay? So do all these things at all times, meaning continuously, constantly, without stopping, and always. So pag huminto kayo rito, ibig sabihin, you're going to get unhealthy and you're about to, you might get crippled, you might get sick, and you might die. So to repeat, this is the health, but it's not, you don't, we know that the real goal is not health, perfect health forever. Wala naman such thing as perfect health, no? Okay. So why are we going to do this? Because we do this because we love our family, your loved ones, so that you don't like to burden them with your illness. So you also love yourself because you don't want to suffer unnecessarily. So this we explained last time, why you need to be and stay healthy at all times. Because the main driving force is that you love yourself and you love your family. So remember, if you don't and stay healthy, who suffers? Okay? Kung ikaw, because health is the foundation that allows people to live, work, think, enjoy, and survive. So when your body and mind are healthy, you function you can function independently, and then you can earn a living, you can take care for a family, and then you think clearly, you can recover from stress quickly, and then enjoy life with less suffering. But if you have poor health, then you can have pain, fatigue, palaging pagod, disability, emotional distress, loss of income, absences, walang trabaho, dependence on others, and then, of course, shorter lifespan kung palaging may poor health. So summary and takeaway, I have discussed what are the preventable diseases that can be aimed for. Yun ang focus in this topic, on how to be and stay healthy at all times, and how you can be and stay healthy at all times in terms of the preventable diseases. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on how you can be and stay healthy at all times. Knowledge is power, it gives power. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on how you can be and stay healthy at all times as part of your health management. So, again, as a reminder, do you love your family? Do you love yourself? If yes, strive to be and stay healthy at all times. If you don't strive to be and stay healthy at all times, then I would suppose you don't love your family and you don't love yourself. Baka ma-accuse kayo niyan. Then if you don't love your family and you don't love yourself, if you don't strive to stay healthy at all times. So this ends my pep talk today on how you can be and stay healthy at all times. I hope I have empowered you to have a basic understanding on how to be and stay healthy at all times in your health management. Before we go to the question and answer portion, reminder after this pep talk, take the OLETE for mastery of learning and have a perfect score to get a certificate like the one shown here. Okay. I placed the link in the chat box. Abet will place it again. And then reminder, obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. And then another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the QA and interaction. Please turn on your video now and show your faces. Okay, ready? Get set. And show your faces. Tama ka, Jem? Lenteria? So, hindi ka makita, Jem? Okay. 1, 2, 3. Okay. So the floor is now open for questions, comments, suggestions, and sharing of experiences, as well as consultations. Anybody? Anybody wants to add more to my recommendations on the how? Meron kayong idadagdag? Yeah, Perla, you're raising your hands. Unmute yourself, Perla. Habang inaayos ni Perla, yan. Sige. Any questions, Perla?
Doktor, yung pneumonia, hindi po ba kasama sa vaccine preventable diseases?
Pneumonia, preventable, yeah, kasama yon.
Parang wala
Pneumonia.
dito, doktor, sa nilagay nyo.
Wala sa communicable, pwede communicable,
Wala dito
pwede
sa
rin.
vaccine preventable diseases.
Pneumococcal, kasama doon, pneumococcal diseases.
Pneumococcal kasama dun sa sambayon.
Meron isang pneumococcal, pneumonia. Doon sa vaccine?
Vaccine preventable diseases.
Kasi, number down the line.
Kasi nakalagay dito is diphtheria, tetanus, whooping cough, mumps, rubella, chickenpox, human papillomavirus, HPV.
Pneumococcal, merong pneumococcal?
Wala po. Pero parang nung sa later part ng iyong topic, parang meron yung pneumococcal.
Okay. Anyway, isama mo na lang doon. So, as I said, we cannot come out with a complete list, no? So, yung pneumonia, So may indications din yun. Yung pneumonia, it's a, hindi naman lahat kailangan, no? So, but usually recommended for people who are yung mga medyo matanda na, medyo mahina, frail, no? Okay, usually binibigay, no? Pero yung mga, let's say, mga masisigla, yung healthy, usually hindi pa, no? Pwedeng wala, no? Okay. Anyway, we will discuss that in the
Bukas.
future when, okay, when to give and when not to give, no? Okay.
Okay po, Doktor. Thank
Okay.
you.
Ikaw ba tumatanggap ka ng pneumonia ano?
Opo,
Pneumonia?
meron nga po ako
Every
yung
year?
Pneumo 23, tapos Prevenar 13, Prevenar ba yun? Prevenar 13?
Ha? Ano yan?
Pneumo 23 na dalawa, tapos Prevenar 13. Susunod daw po yun, Prevenar 20 ba yun? Prevenar 20.
Yung gamot,
Sa
yung
pneumonia,
vaccine.
sa vaccine ng pneumonia.
Yeah, vaccine. Sige. Ako, actually, I've not received any anti-pneumonia vaccine for the past 77 years.
Oh,
Okay. Okay.
kasi
So, wala pa ako pneumonia. So, anyway, sige, I'll try to make a discussion on that in the future.
oo nga po.
Okay. So, kasi yung susunod na topic ile-lecture ko next week is how I, as the physician, can help you. No? Okay. So, ako, bino-volunteer ko sarili ko sa inyo na tutulungan ko kayo, but I do not promise, no? But I'll try my best. Kasi, number one, hindi, although I'm a physician, I don't know everything yet, no? Mahirap malaman lahat. Medicine is evolving, no? Saka medicine is so inexact, maraming gray zone, maraming iba-ibang sinasabi, no? Okay, nagpapalit-palit every year, no? So, so I will try to dissect and tell you which one will be the most cost effective, no? So which one will be minimalist approach? Which one will be the most cost effective? So yan ang ituturo ko sa inyo at I will also use myself as a role model, no? Okay. Kung ano yung ginagawa ko, ituturo ko rin sa inyo, no?
Okay
So
po, Doktor.
example, as I said, for the past 77 years, hindi ako nag-pneumonia vaccine, pero marami dyan nagre-recommend pneumonia vaccine, no? I'm not saying na mali, no? Pero may mga indications, no? So baka yung mga ang basic indications, yung mga those are at high risk for pneumonia. Kung tinamaan siya pneumonia, baka deadly siya. So dapat merong pneumonia vaccine. Pero yung mga those who are healthy, small risk for a significant disease, complications ng pneumonia, pwedeng wala. Na? Okay. Okay. Anyway, i-discuss ko next time. Na?
O sige nga po, Doktor. Thank you po.
Okay. Pero sabihin mo nga sa akin, hindi ka pa naninimonya? Gaano katagal ka na naging pneumonia vaccine?
Ako, Doktor?
Ilang years na?
Matagal na, Doktor, kasi yung Pneumo 23 ko is 2008.
8 every
Tapos,
year?
after 5 years, Pneumo 23 ulit, 2013. Tapos, nung 2018 is Prevenar 13. Tapos, yung Prevenar 20, yun na lang daw po ang huli. Lifetime na daw, sabi ni Doktor nung nagtanong po ako.
Okay. Wala na.
Isa na lang po, yung Prevenar 20 na huli.
Okay. So, sige, I'll try to, okay. Pero nagpo-flu vaccine ka rin?
Ano po?
Nagpo-flu vaccine?
Opo, last month sa Mercury. Kasi sa Mercury nag-offer po sila ng mga vaccine.
Libre?
Hindi po. May discount lang, senior discount.
Okay. So, what's your experience with flu vaccine?
Wala naman doktor, wala na akong naramdaman.
Hindi, hindi ka nagkakaroon ng flu after kahit na with vaccinations?
Parang awa ng Diyos, parang hindi naman doktor.
Okay, good. No? Pero may naririnig ka nag-flu vaccination, nagpo-flu pa rin.
Ano po?
Merong tinatamaan pa rin ng flu kahit na may flu
Ay, meron din
vaccination.
po doktor kahit na naka-flu vaccine.
Okay.
Meron pa rin.
Yeah, okay. So we will discuss that in the future, no? Okay. So I will try to
Opo.
cover from here on kasi on our sixth year nito ng PEP Talk, no? So I will try to cover all the diseases that I mentioned about preventable diseases. No? Yun ang focus ko, no? Okay. So, i-detalya ko na lang, na? Okay. Okay? So, any more
Ano po?
questions? Any comments? Anybody? Meron pa kayong dadagdag yung sa how? Wala na? Ginagawa ba ninyo? Okay. How?
Doc, may question ho ako.
Sige, Belet.
With regards po doon sa vaccine, yung pneumonia vaccine, meron pong 5 years at saka merong lifetime. Alin po doon ang mas okay? Pneumonia vaccine.
5 years?
Meron pong pang 5 years, meron din pong lifetime.
Prevenar.
Palagay ko, correct me if I'm wrong, ha? Kasi ang alam ko yung mga vaccine na yun, nagbabago kasi yung mga bugs yung mga mikrobyo, no?
Mhm.
So baka mas maganda kung 5 years na lang, ganun, para after 5 years, no, pwedeng another new vaccine, baka lumabas new vaccine.
Opo.
Ah,
Parang sa ano po sa flu vaccine, yung yearly po nagbabago. Ano po?
Oo, nagbabago yung strain. Yan ang alam
Mm.
ko, ha? Pero
Wala naman.
yung sa flu, sigurado ako sa flu, they have to look for the pinaka-common na strain na virus, then they try to make a vaccine for the year. For the year. Every year kasi nagbabago no? Okay.
Mhm.
Then yung sa pneumonia, I guess nagbabago rin yung mga mikrobyo na yun. That's why we have may tinatawag tayong mga antibiotic resistant na mga germs, di ba? Ganon.
Opo.
Baka nagiging resistant, no?
Mhm.
So, baka
So, mas
mas
okay
maganda
po
yata
yung
yung 5 years na lang kung ano
Oh,
kayo.
okay po.
Magkano ba yung difference? Magkano yung
Hindi ko lang
presyo?
ho alam. Hindi ko ho matandaan. Pero date in ho
Mahal.
ang tinanong ko ho yung sa flu vaccine. Doon ho sa Medicard clinic parang 800. Sa iba naman ho 900. Sa ospital ho 1,600. Kamahal sa ospital.
Ay, ang
Huwag
mahal.
kang pupunta ng hospital.
Mhm.
Basta, okay. Basta pag sa between hospital and outpatient, mahal talaga ang hospital. I-avoid yung
Mm.
hospital as much.
Oo.
Okay.
Mhm.
Basta i-avoid, basta number one lesson here, kung sa private hospital, i-avoid niyo yung private
Yun ho
hospital.
oo,
Kaya
mahal ho
niyo.
talaga.
Mahal talaga, no? Kahit na yung thyroid function test ninyo, no?
Mhm.
Pag sa hospital, maabot ng 8,000 yung tatlo.
Mhm.
Pag doon sa labas, no? Usually mga 2,000, 3,000 lang. Ang laking difference, no?
nga po, nasubukan ko na po yun. Kaya po sa mga ano na lang po ako, diagnostic laboratory na lang kami
Oo,
nagpapaano.
tama yon, no? So basta as a rule, try to avoid hospital setting. So,
Mhm.
okay. Kung sa mga laboratory, unless wala kayong hindi magagawa yung laboratory na test sa labas, di ba? Okay.
Mhm.
Pero sa ngayon, halos lahat meron na di ba? Pati sa
Opo.
labas, no? Okay. Okay.
Doc, isa pang question.
Sure. Sige,
Yung
balik.
with regards po doon sa gamot sa thyroid,
Oo.
yun ka pong levothyroxine at saka levothyroxine sodium pareho lang.
Levothyroxine,
Sodium ho. Kasi yun
sodium.
yung ano ho, yung bayo ko, ang kanyang iniinom na gamot, ang pangalan ho ay T4. Samantalang sila, yun hong asawa, yung sila na nagpa-check up sa inyo dati. Yung
Oo.
inreseta ninyo ay Tidine. Kung pwede
Oo.
daw pagparehohin na lang nila.
Pwede, basta
T4.
parehong levothyroxine.
Hindi po, yung pong isa ay may levothyroxine sodium.
Yung isa,
Yung pong sa inyo, levothyroxine lang.
ah, shortcut lang yun. Pareho lang yun.
Pareho lang ho yan.
Oo, hindi ko na nilalagay yung sodium, no?
Kahit
Kala
ho
ko,
anong brand pwede, basta ganun ang generic name.
yung levothyroxine, kahit na anong brand, pero iwasan yung mahal, di ba?
Oo, yung mura
Ang,
na lang.
ang pinakamahal dyan, Euthyrox.
Oo nga po. Mahal
Okay,
nga po yun.
ang mas mura-mura, Tidine and uh, Eltroxin.
Eltroxin.
Eltroxin at saka Tidine. Ang
Mhm.
pinakamura, meron pa isa, for hypo.
Oo, yun nga po. For
Yung,
high po. Kaso nga
yung
po, ay sabi niya tigwa 100 milligram lang yun. Wala akong
ano,
tigwa 150. Ang dosage ho niya ay 1 milligram.
100.
100 pala, 100.
Oo. So,
Oo.
for hypo, 100 microgram din yun eh.
Mhm.
So, kung ano niya, kasi yung presyo ng for hypo is only 550.
Mhm.
No?
Mura nga po yun, mura po.
And then yung Tidine, mga 11 pesos. No?
Aha.
And then kung may senior ka pa dun sa for hypo, magiging 330 na lang.
Mga kabura na.
So, kung makakakuha kayo noon, yung high for hypo na lang bilhin ninyo. No? Okay.
Sige po, Doc.
So, yan pa isang tuturo ko sa inyo, next is how to pipili kayo ng make decisions on how to get the medicines at the lowest cost. Kaya sabi ko,
Mm.
cost effective, no?
Apo.
Cost effective, no? So,
Sige, salamat po, Doc.
kung saan tayo makakamura, no? Okay. Okay.
Sige po, thank you po.
You're welcome. Any more questions? Jem? Yan na si Jem. Okay, anong nag-raise ang hand si Jem? Jem, anong tanong mo, Jem? Lenteria? Nag-raise ka ng kamay, Jem? Lenteria? Nawala na siya. Baka nagkamali lang yung pindot. No? Okay. Any more questions? Kung wala na, we'll call. Ayan, wala na. Pala ako may papasok pa. Kung wala na, we'll call it a day. We'll see each other next week. Ang topic ko is how I will help you in become to be and stay healthy at all times. No? Okay. So Tutulungan ko kayo how to be healthy. Magiging partners tayo na, okay, on how to be healthy. It's either whether you have healthy without disease, healthy with a controlled disease, especially those who are unhealthy, yung may sakit na, okay. So I suppose all of you present here, wala namang unhealthy sa inyo ngayon, na, okay. Okay. So, ayan, pumasok na si Jem. Jem, anong may tanong ka, Jem? Unmute yung sarili mo. Jem is from Pagadian, from Zamboanga del Sur. Yan, Jem.
Ay,
Anong
Doc,
tanong mo, Jem?
magandang hapon po.
Yeah.
Doc, yung
Hmm.
sa for high po na lebo at saka Tidin, ano po, kanang pwede bang pagsabayin yung yung pang-asthma ko, yung yung tambal na pang-asthma?
Pwede. Pwede sa asthma? Oo.
Yes po,
Pwede.
yes po.
Pwede. Okay. Ano yung binili mo? For hypo or
Tidin po.
walang for hypo sa inyo, di ba?
Nagtanong ako sa Rose Pharmacy, wala silang available.
What? Baka sa Maynila lang meron. So, baka mag-order ka na lang sa marami. Kung may kikilala ka, mag-order ka ng marami sa Maynila, iuwi mo. No? Kasi mura lang yan eh.
Opo. Doc,
550, 350, 320. Ano pa? Ano pang tanong mo, Jem?
ano po Doc, yung sa leeg ko po, normal lang po ba ito yung parang yung piniga yung nasa ilalim?
Oo. Opera mo lang eh. Luluwag pa rin yan.
Okay Doc, akala ko na.
Hindi, luluwag pa yan. Luluwag pa. Na? Okay. Wala
Opo.
pang 5 buwan. Wala pang 3 buwan. Di ba?
Opo, kaka 1 month ko pa lang kahapon, 21.
Mhm. Okay. So,
Sige
okay.
Doc, yun. Opo Doc, salamat Doc.
Sige. Okay. So, we have a new member, James from Pagadian, from Zamboanga del Sur. Okay. Welcome. Okay. So, kung wala na kayong tanong, kuha tayong picture. Hindi kasama si Jem kanina. Ngayon, lumabas na yung picture niya. Kuha tayong isa pang picture. Pwede? Show your faces. Sama natin si Jem. Welcome natin yung bago nating member. Ayan. One, two, one, two. Okay. Okay, so we'll see each other next week na lang kung wala na kayong tanong. Okay? Goodbye.
Doctor, thank you.
Bye-bye.
Thank you, Doc.
Bye-bye.
Salamat, Doktor.
You're welcome.
Doc po. Bye.